Hello, thank you for joining us. This is the Protocol Information Administration of TXA. So we're going to take a look a little bit about TXA, a little bit more information before we get into why we're going to be giving it and also how we're going to be giving it via the IV pump. So why should we use TXA? So hemorrhagic shock remains a serious problem with the multiple trauma patient. It is a leading cause of preventable trauma death after loss of the airway. Rapid and effective control of extenuation hemorrhage has been demonstrated to markedly improve survival and outcome. Of course, there is increased use of tourniquets has reduced death from hemorrhagic shock in the most recent wars fought by U.S. and NATO forces, as well as, believe it or not, we've had lots of success with stopping the bleed through the use of tourniquets by teaching lay people how to use it. But the reason we want to give TXA is because it's going to help us to be able to prevent death in a lot of these patients who are hemorrhaging. So tranexamic acid is a competitive inhibitor of plasminogen activation, which produces antifibrinolytic effects, preserving and stabilizing fibrin's matrix structure. It reversibly binds to plasminogen and a lysine binding site, thus preventing the binding of plasmin to fibrin. It is categorized as an antifibrinolytic that inhibits the activation of plasminogen to plasma, and thereby preventing fibrolysis and the breakdown of clots. So really what this medication does is it prevents clots from breaking down. And so it helps the body to hold on to those clots and making, hopefully being able to stop hemorrhaging. So the history of TXA, it has been used for many years to assist with the management of spontaneous hemorrhage in the hemophiliac. The management of hemorrhage and combat wounds has been reported in several papers, but it's also being used for postpartum hemorrhage. It's been used for several years overseas for nosebleeds. They even use it as a nasal spray as TXA, and a lot of the feminine products used for tampons and different things I've seen overseas over the years have TXA binded into them. To help keep clotting going on. It's kind of been around for a while, and it's a really, really good medication. So let's take a look at the CRASH-2 study. One of the most significant findings in the CRASH-2 study is that the use of TXA is associated with a 1.5 absolute reduction for the death from hemorrhage. Other studies show that TXA is most effective if given within 3 hours of the injury and may be detrimental if given after that time. So a little more information. So TXA in concentrations of up to 10 milligram per milliliter in blood show no influence of the platelet count, the coagulation time, or other coagulation factors in the whole blood or citrated blood from normal subjects. It does not bind to cerebrobinium and has a half-life of about 2 hours. And urinary excretion in the main route of elimination via the glomerular filtration system. So it is an antifibrinolytic drug and a synthetic equivalent to the amino acid lysine. It does help reduce mortality in the acutely hemorrhagic adult trauma patient and the OB patient as well, if given within the 3 hours of injury or as soon as postpartum hemorrhage is apparent. So things to consider. So some of the good things here, the side effects of the agent are minimal and the contraindications are few. It's administered as a simple IV infusion and does not require any refrigeration. And it's also relatively inexpensive. So here are indications for giving TXA. The first thing is the patient has to be greater than 16 years of age. Has to be it has to be less than 3 hours post-bleeding onset. Has to show hemorrhagic shock with a systolic blood pressure of less than 90 and a heart rate greater of 110. It is indicated for multi-system trauma, a major pelvic fracture, solid organ injury with evidence of active hemorrhage, traumatic amputations, and postpartum hemorrhage. So contraindications is a subarachnoid hemorrhage or known isolated head injury, active intravascular clotting and or known history of thromboembolism, known history of renal failure, or concomitant use with thrombin complex concentrate, PCC. So here are some adverse reactions that can happen with TXA. We can have GI disturbances may occur, but disappear when the dosage is reduced. Hypotension has been observed when intravenous injection is too rapid, and to prevent that, that's the reason that we give it on an IV pump. It should never, ever, ever be given by gravity and certainly shouldn't be given as a bolus. To avoid this response, the solution should not be injected more rapidly than 10 milliliters per minute. So side effects can include anaphylaxis, thrombosis, nausea, vomiting, and diarrhea, visual disturbances, blurred vision, changes in color. The patient can be hypotensive with a rapid infusion rate, and so that's why it's going to be ran on an IV pump. So our dose is going to be 1 gram and 10 milliliters, and it's going to be given over the IV pump over 10 minutes. So how to give TXA on the IV pump? Let's take a look at how to do that. So our equipment needed is we're going to need a vial of TXA. We're going to need a 10 milliliter syringe. Make sure that you have the Med System 3 half set IV tubing. So this tubing is going to look very similar to the MedSet 3 tubing that we use, but it's going to be a little bit different and a little shorter. Make sure you have the correct tubing. You're going to need a 10 milliliter IV flush and normal saline. I like to have 2 of them, so I have a spare. You'll need a filter needle and, of course, alcohol preps to make sure you're cleaning everything as you go to prevent any infection. Step 1. Using a 10 milliliter syringe and a filter needle, draw up 10 milliliters of TXA. Once the syringe is filled, take off the filter needle. Step 2. Open the half set, which looks just like that, and insert the 10 milliliter syringe of TXA. You're going to begin to flush the IV set with the TXA. Once you flush the set, it will take approximately 6 milliliters of TXA to prime the set. You should have 4 milliliters of TXA left once you have primed your cassette. Step 4, this is setting up the pump. So your rate is going to be 60 milliliters an hour. Your volume to be infused is 10 milliliters. Once you have that, you should be ready to go. Step 5, you're going to start the infusion. When they form, so all you have to do is once you get it set up and everything is you're going to hit the start button right here and start your infusion. When the 4 milliliters is infused, so it's given the complete 10, place a 10 milliliter flush to flush the TXA line. So you should be at the hospital by then, but if not, if it pulls all of that 10 milliliters down, just add another one. One of the things that we want to make sure that we are doing if we have a hemorrhagic patient is we want to do frequent assessment. Repeat vitals every 5 minutes. So a 4-lead EKG is required. I would highly consider capnography. Make sure you're taking a temperature. Make sure you're getting a pulse ox and a blood pressure. Frequently reassess and make sure and see how your patient is doing. So this is the video portion. There is a skills station that is required. To complete this assessment, you must sign off on the administration of TXA with either myself or Deputy Chief Josh. Thank you so much for watching, and we look forward to bringing this exciting new medication out into the field to help our patients who are possibly hemorrhaging. And I'd be more than glad to spend a little time to show you how to administer the medication via the IV pump. If you have any questions or anything, feel free to let me know. Thanks so much, guys. Have a fantastic day. Bye-bye.